hurt me a bit, as they always say.
That's nice.
All right.
Oh, Christ, this is gonna hurt. There's not a belt or anything I can chew on.
This might be a pillow.
Just feeling wiggling.
Yep. That's what we try to do. I don't try to whip it out like some sort of wrestling move or something.
So I YouTubed one night when I first, like the first 4 days.
Yes.
And I was watching these removals.
Oh, yeah.
And some looked pretty good, and then others people were like crying. So I'm interested
Yeah,
in
well,
it.
yeah, some of that is patients, some of that is doctors. I mean, honestly, some people are just cruel and unusual in their punishment.
But then I start going in that rabbit hole.
Yeah,
And I
well,
start
that's
watching
right.
the surgeries of like hammer toe correction surgery and how you do it. It's pretty
Right.
cool. Like, did you cut out that middle part and then like when I was watching this video?
Oh, yeah. So I made the incision over here, cut out the joint basically,
Mm-hmm.
and then fused it. Yeah.
But isn't there like a wire that you fuse inside there?
Sometimes you can use an all internal sort of double threaded screw.
Mm-hmm.
The problem is some of those don't heal, and then it's impossible to get the screw out.
Mm.
So this is kind of nice because it goes away in 4 weeks, and then you don't have any hardware to worry about.
Now it kind of hurts a little. It's just more on the tip
We're
of the
gonna
toe.
need bigger, like a true biggest you got. You're gonna have to time lapse this one.
Oh well.
Yeah. We'll get the hammer and.
So if you're an ortho, why did you decide to specialize in feet and ankles?
That's a good question. I was like most of the ortho residents, wanted to do sports medicine, work with athletes and teams and stuff like that. And I got about 3 years into residency, and that's kind of at the end of third years when you have to decide what you want your fellowship to be.
Yeah.
And our residency just hired 2 new foot and ankle guys, brand new out of fellowship, and the surgeries are just really cool. And you really, if you do foot and ankle orthopedics, nobody else wants to do it. So it's kind of your own thing,
It's more of a niche market.
Yeah, so like none of my partners, like they are more than happy to give any bunion, any whatever, Achilles, all that stuff. Don't deal with it enough to get good at it, and they're happy to hand it over. So it works for me, and well, this might just be a part of you, Kurt. Cute, right?
So you're from Alabama then, right?
Yeah, I grew up in Florida and Alabama, so I don't, unless you get me really drunk, you won't hear much of a Southern accent.
Did you go to Alabama as undergrad?
I went to Auburn as an undergrad.
Oh,
yeah.
okay.
And then I went to University of Alabama School of Medicine. But that's not in Tuscaloosa, that's in Birmingham. That's not where the football school is.
So you didn't go any games?
I didn't go to any Alabama games, no. I mean, other than the ones when they played at Auburn, yeah. Well, now we're making progress.
And you decided to come to Seattle because they recruited you, or?
I decided to come to Seattle because I met my wife in residency in Massachusetts, and she's from Hawaii. And so we knew we wanted to be on the West Coast, a direct flight. And we looked at, we decided we were not LA people, so we looked at San Fran and Portland and Seattle.
Yeah.
And picked Seattle.
That's cool. Ah, nice. That really wasn't that bad.
Yeah.
It's easy.
It's easy.
Because it's in the bone, right? Is that why? Not the nerves?
Yeah, usually just sort of initially getting it loose causes people pain, and then sometimes as it passes through the different joints, there'll be a little bit of pain. All right, so let's get a Band-Aid on there, and then we may double bag you since we got a bleeder, huh? It's not too bad actually at all, but once you stand up and start moving, then the bullet will rush down there, and you might get so we'll do a double dose for you. Now, what I would suggest, Kurt, is I'm going to give you some. Do you want to keep this?
No.
Okay,
It's fine.
good. That's the right answer. So, some tape.